This is the To Health With That, Naturally Healthy in No Time podcast for big health topics taken in small bites. I'm your host, naturopathic Dr. Amy Newsel, and this is Season 1, all about the MTHFR mutation. This week, let's talk about the magic that happens between fish oil and B vitamins. We've all heard about fish oils and omega-3 fatty acids for so many incredible reasons. They're strongly anti-inflammatory and perform almost as well as non-steroidal anti-inflammatory medications do for pain relief, but without any of the side effects. They've been studied extensively for heart disease and show an almost unbelievable array of benefits. Fish oils reduce the risk of sudden death from cardiac arrhythmias, reduce all-cause mortality, which is death, in patients with known cardiac disease, and help to treat high cholesterol and high blood pressure. That's hyperlipidemia and hypertension. All of this without significant side effects or drug interactions. Studies have also shown that countries with higher intake of omega-3 fatty acids have lower rates of depression. Unfortunately, they have not found omega-3 fatty acids to be an effective treatment for depression that already exists. Fish oils have also shown beneficial effects in both research and clinical practice for diabetes, Alzheimer's disease, stroke, and autoimmune disease. And you'll notice that a lot of these categories of disease for which fish oils help are actually categories that are common to MTHFR and unbalanced methylation. So most studies about fish oil, in fact, almost all studies about fish oil are not MTHFR specific, but fish oil has benefits for so many of the long-term consequences of unbalanced methylation in MTHFR that it makes sense that there could be some link. What research has found is some kind of magic, some kind of synergy between fish oils and B vitamins in which the combination works better than either therapy alone. A randomized placebo-controlled trial of people with mild cognitive impairment, this is usually memory loss in advancing age, found that treatment with B vitamins lowered homocysteine and slowed the rate of cognitive decline. We know that, right? Researchers went back and reanalyzed the data from this study to see if baseline levels of omega-3 fatty acids interacted with the results in any way. The study involved mental testing over the course of 2 years, and they found that for all outcome measures, higher concentrations of DHA specifically significantly enhanced the effects of B vitamins. The levels of EPA, which is another of the long-chain fatty acids, the omega-3 fatty acids, had less of an impact. Not only that, when omega-3 fatty acid levels were low, they showed that B vitamin treatment had no effect on cognitive decline, meaning that B vitamins without fish oils were not effective. But when omega-3s are in the high normal range, B vitamin treatment became very effective. So some synergy was happening there that needs further investigation to fully understand. Since omega-3 fatty acids are good for so many things and truly haven't shown negative consequences, it makes sense to add them in as a no-risk measure for seniors with cognitive decline. There is also a link with homocysteine in other populations. The methylation process itself seems to be involved in the metabolism and distribution of these polyunsaturated fats, which is the omega-3s, through your body, which means that MTHFR and omega-3s are intimately linked. Also, it's been theorized that omega-3 fatty acids actually have expression control on enzymes within the methylation cycle. So, effectively, MTHFR controls omega-3s, which control MTHFR. There's not a big enough body of research yet to draw firm conclusions, but the evidence is pointing in this direction. For MTHFR folks, the most important thing to understand is that using omega-3 fatty acids and B vitamins together produces a better reduction in homocysteine levels than using either one alone. This research suggests that omega-3 fatty acids, referred to in this study as PUFA, which I love, of course, or polyunsaturated fatty acids, actually stimulates the action of the MTHFR enzyme, which, of course, we know activates folate to generate SAMe, which is your master methyl donor. PUFA also stimulates the MAT enzyme, which converts methionine to SAM, and also the CCT enzyme, which is involved in the conversion of choline to phosphatidylcholine, and the CGL enzyme, which is involved in the conversion of homocysteine to glutathione. All of those we need to be functioning, but of course MTHFR is our primary concern. Inflammation, heart disease, cognitive decline, and high homocysteine are all problems that happen more frequently in folks who have MTHFR issues with unbalanced methylation, and since fish oils effectively address those problems, it almost seems like a gimme. Next week, we'll talk about a few tiny bits of research that are emerging regarding fish oils and gene expression for MTHFR folks. The research is new, but it's starting to get good. Thanks for listening, and I'll talk to you next week.